7 red flags men over 60 must know. Here in today's video, we'll go over some serious information that might end up saving your life. Envision a world where you could catch prostate cancer in its earliest stages, before it spreads, and get a head start on treatment for a better life. In this section, we will discuss 7 important warning signs of prostate cancer that should be known immediately. This information is crucial, whether you are directly impacted or just concerned about the people you care about. Knowledge is power, so keep that in mind as we navigate these red flags. The difference between a successful treatment and a much more difficult fight later on can be as simple as early detection. To kick things off, please subscribe and like this video if you find health advice and empowering insights helpful. Being a part of a community that values health, prevention, and well-being is more important than simply clicking a button so that you can make an informed decision for a healthier future. We are here to give you reliable information. The most important warning sign is at the top of the list. So let's start with number 7 and work our way down. Everything you need to know about each symptom is right here, along with advice on what to do if you experience any of them. Get out your notepad because we're going to walk you through these crucial early indicators that could significantly impact your health journey. 7 sign: UTIs or problems urinating on a regular basis. Number 7 on the list of warning signs is a history of urinary tract infections or persistent problems passing urine. In addition to experiencing symptoms like burning, cloudy, or offensive-smelling urine, or pain in the lower abdomen, you may find that infections are occurring more frequently than normal. On top of that, you might have an ongoing urge to pee, but have trouble actually going to the bathroom. For example, you may find that you have to strain to urinate, or that you only have a weak stream of urine even though you're really thirsty. Although these symptoms may appear to be random occurrences at first, especially if they happen occasionally, their recurrence may serve as a subtle warning that your prostate health isn't ideal. It may be very important to keep track of how often and how drastic these changes are. If you notice that these problems with your urine continue, it's best to talk to a doctor so you can figure out what's wrong and start treating it right away. 6th symptom: incontinence or interrupted urine flow. Alterations to the regularity and intensity of your urine output are another warning sign to keep an eye out for. Number 6. A weak stream or occasional minor disruptions might be easily dismissed as unimportant, but when they become frequent, it's a red flag that needs to be investigated. The force with which you urinate may decrease, or you may find that you urinate in a staccato fashion. The presence of an obstruction or inflammation in the urinary tract, which may be associated with prostate changes, can be indicated by this deviation from normal flow. These little changes in your body's urination control mechanisms can, with time, become major issues. Notify your doctor these changes, such as how long it takes to empty your bladder or the consistency of your stream, can be very helpful. Seeking medical advice at an early stage can help identify the source of these symptoms before they progress to more serious problems. The 5th symptom is an increased need to urinate, particularly during the night. A sudden and persistent increase in the urgency to urinate is another important sign that shouldn't be ignored, especially if it disrupts your sleep. This brings us to number 5 on the list. Aside from being a major disruption to your sleep and energy levels during the day, getting up multiple times during the night to use the restroom could be an indication of prostate problems. Because it disrupts sleep, which is normally a relaxing process, and can leave you feeling exhausted the next day, this nighttime urgency is usually more noticeable. Constantly having to get up and go peek and mess with your sleep schedule, but it can also cause other problems like dehydration or pain all day long. Notice if any additional symptoms, such as pain, discomfort, or changes in urine color, accompany this increased urgency. If you want your healthcare provider to be able to diagnose you and intervene quickly, which could be crucial to managing your health effectively, keeping a record of these symptoms can help. 4th symptom: presence of blood in urine or sperm. 4th on the list, you should never ignore the serious warning sign that is the presence of blood in your urine or semen. The symptoms of this condition can include the presence of unusually colored urine, pink, red, or brownish, or the discovery of unexpected blood in the semen when ejaculating. Although this symptom can have many causes, e.g. kidney stones or infections, it should be taken seriously when it occurs alongside other symptoms related to prostate. You must know that if there is blood, It could mean that the prostate or its surrounding tissues are not doing well. Inflammation, infection, or, more worrisomely, early prostate cancer could be to blame. Seeking prompt medical attention from a qualified physician who can administer the appropriate diagnostic tests is essential, regardless of how infrequent the occurrences may appear. For early diagnosis and treatment, it is important to pay close attention to the sign, record how often it occurs, and determine if it is accompanied by pain or discomfort. It is crucial to remember that taking action early on is crucial, and that treating these symptoms promptly can greatly impact your ability to maintain good health in the long run. Symptom number 3, hip, pelvic, or lower back pain. Third on the list of possible warning signs is ongoing pain or discomfort in the hips, pelvis, or lower back. Pain like this doesn't come and go. It's constant and persistent, and it can get worse with time. From a subtle, persistent ache to more intense, upsetting sensations that interfere with everyday life, the pain can range in intensity. Many men attribute this kind of discomfort to everyday wear and tear or to strenuous physical activity. Chronic pain, along with other symptoms like changes in urine flow or difficulty urinating, should prompt serious consideration as an early indicator. Your doctor will benefit greatly from your meticulous documentation of your pain, including its onset, duration, and any triggers. To ensure that any underlying conditions are treated quickly and effectively, it is important to recognize and address these signals early on so that you can take proactive steps towards seeking the proper evaluation. Number 2, impotence. The second most important indicator that may be associated with prostate problems is erectile dysfunction, ED, which comes in at number 2. There are a lot of common causes of erectile dysfunction, ED, but when it comes along with other symptoms in the pelvis or urine, it could be a sign that your prostate isn't doing well. Changes in blood flow, nerve function, or hormonal balance can be linked to inflammation or growth in the prostate, which can impact more than just sexual performance. Feeling frustrated or worried is normal if you have trouble getting or keeping an erection, or if your erections aren't as good as they used to be. When you notice a change in your sexual function, it may be a sign that your body is trying to tell you something bigger is wrong and needs fixing. It is essential to have a candid conversation with your doctor if you notice these changes, especially if they come on suddenly or get worse with time. If these symptoms are associated with prostate health, or if there might be another factor at play, a thorough evaluation, including diagnostic tests and physical examinations, can help identify the cause. First symptom, pelvic pain or discomfort that does not go away. Of all the signs and symptoms to keep an eye out for, the most important one is persistent pelvic pain that doesn't go away. This kind of pain isn't always temporary. In other words, it won't go away even after you take over-the-counter pain medications or get some rest. You might feel a dull ache or a sharp, stabbing pain that travels to your lower back, hips, or even your upper thighs. Due to its location deep in the pelvic region, the prostate is particularly vulnerable to referred pain from any structural abnormalities, such as inflammation, growth, or other pathological changes. Because it may be the initial indicator that warrants additional testing before other sexual or urinary problems become apparent, this symptom is especially worrisome. You shouldn't ignore the pain just because it's subtle at first. If it persists, you should seek medical attention. Your healthcare provider will be able to better diagnose the source of your pain if you keep a thorough record of its onset, duration, and severity, as well as any activities that bring it on or help it go away. Timely medical intervention can greatly improve long-term health outcomes. So early detection through careful observation of these symptoms is paramount. Your attention to these vital early indicators of prostate cancer is greatly appreciated. With any luck, you'll be more equipped to monitor your own health and consult a doctor if you notice a problem after reading this. It is crucial to detect issues early. Treatment options and general health can be drastically altered by it. If you enjoyed this video and thought the insights were helpful, please consider giving a like, subscribing for more health tips, and sharing it with anyone you think might find it useful. More people will get access to potentially life-saving information because of your involvement. Now that you've learned everything, think about it for a second. If you have any questions or stories to share, just hit the comment button. The greatest way to ensure a healthier future for oneself is to remain educated and take initiative. Maintain vigilance, attend to your health, and keep in mind that your health is your most valuable possession Until we meet again.